Welcome to the fifth topic of this course. We are now going to zoom in and look at some of the specific TB preventative therapies. At this point in time, we will look into isoniazid prophylaxis therapy. So we have adequate evidence that shows us that isoniazid prophylaxis therapy works. It reduces the risk of TB in HIV-positive individuals by up to 64% in patients with positive TST tests. That means these are patients who have a confirmed exposure to TB, but also significantly reduces the risk of TB in HIV-positive individuals by up to 33% overall, irrespective of the TST results. So in terms of how does a patient become assessed or access IPT prophylaxis therapy or even TPT, specifically focusing on adults and adolescents living with HIV and AIDS. Screening is very important. It actually determines entry into the program. The requirement for TB screening is that all people living with HIV and AIDS, right, should be TB screened at every visit or every contact. So we use these 4 questions: cough of any duration, fever, weight loss, and night sweats. If the client or patient who is being screened has any of these symptoms, we then have to investigate them for TB, right? If TB is confirmed, they would be treated for TB. If TB was not confirmed, maybe this was a community-acquired pneumonia or flu or things like that, we would then proceed to provide necessary follow-up and consider them for preventative therapy at a later stage. And if there is another diagnosis, irrespective of what that is, we would then provide appropriate treatment as needed. If a patient is screened and they do not have symptoms, we need to assess for contraindications to preventative treatment. If they do have contraindications, we therefore need to defer or postpone preventative treatment to a later stage and deal with that contraindication. If someone has no TB symptoms, we assess them for contraindications to preventative therapy, and they do not have any contraindications. They are therefore eligible for TB preventative therapy. They would be initiated and then be seen regularly for support, follow-up, and also to ensure that they do not run out of medicines. So at the high level, this is how we would approach this program and ensuring that the majority of our people living with HIV and AIDS are screened and they are assessed in terms of contraindications, and hopefully the majority of them will then be initiated on TB preventative therapy. So in terms of TB screening and assessment of pregnant women, screening is very important because it determines, the entry into this program. So we still recommend that every person who presents for care should be screened for TB, and should also be assessed for contraindications to TB preventative therapy. If those contraindications are excluded, therefore they can be offered TB preventative therapy. Specifically in pregnancy, we do provide the TB screening symptom, but the antenatal care guidelines in pregnancy have changed. They now include a diagnostic test, TB expert test, regardless of symptoms. So whether this TB symptom screening comes back positive or negative, all women who are HIV positive, who are also pregnant, it's now a requirement that a baseline expert test be done. And this is mainly because TB is quite common in our pregnant women, and it is linked to bad obstetric outcomes if they are infected, but also it can also contribute to deaths of our mothers. So we want to just ensure that we exclude TB in pregnancy as much as we can. There's now an important change in the guidelines. So if, for example, the TB screening is negative, you do the TB expert test, which also comes back negative, right? It means she's probably eligible for TB preventative therapy, specifically INH prophylaxis therapy, right? We also need to assess the CD4 count of our patient. If the CD4 count is less than 350, we should prioritize them for isoniazid prophylaxis therapy. Women who are HIV positive with a negative TB screen and a negative gene expert, where the CD4 count is above, it's higher than 350, are not eligible for isoniazid prophylaxis therapy. They should actually be excluded from that. There's current research going on and assessments and literature reviews going on to review the implications of INH in pregnant women with high CD4 counts, as there is an association with some negative outcomes. So eligibility criteria for INH in pregnancy is a negative TB screen, a negative gene expert, and a CD4 count that is less than 350. This is a new change. Previously, we used to only give INH to women with CD4 counts less than 100. So this has been reviewed to a higher CD4 count. So in terms of assessing eligibility, who is eligible for isoniazid prophylaxis therapy? So all HIV-infected non-pregnant adults, adolescents, whether on ART or not, who have completed a course, who have not completed IPT before, should be considered for IPT. HIV positive pregnant women who have a negative TB screening and a negative gene expert test with CD4 counts less than 350 are now eligible. HIV positive patients who are former, so someone who has been cured of TB before, they are eligible for isoniazid prophylaxis therapy. Who is not eligible and should be excluded from accessing isoniazid prophylaxis therapy? That would be anyone who's confirmed or suspected active TB, pregnant women with CD4 counts above, with high CD4 counts, patients with active acute or chronic, any form of liver disease, basically, history of adverse reaction to INH, severe peripheral neuropathy, or even a hypersensitivity reaction, and then excessive alcohol abuse. So any patient who meets this criteria should not be considered for INH prophylaxis therapy. And then these are the groups that would qualify for such a treatment. So just a reminder that the 350 is new. The guidelines have been updated. The PMTCT guidelines, including our essential drug list guides, have also been updated to ensure that there's alignment around pregnant women who need to access isoniazid prophylaxis therapy. Right. So also remember that those who previously had TB preventative therapy, but are currently exposed to a confirmed TB case, right, are actually eligible for TB preventative therapy. And then any patient who successfully completed TB treatment, but currently are exposed to someone in their household, close contact, who's got TB, they should be considered for TB preventative therapy as needed. Right. So in summary, TB screening is key. It offers entry into either TB treatment or isoniazid prophylaxis therapy. So we always start by providing TB screening. Those who have symptoms are then investigated and started on treatment or managed as needed. Where TB is excluded, they can be considered for TB preventative therapy after monitoring for 3 months without symptoms, right? Where TB screening is done and the patient is asymptomatic, no symptoms, we need to assess if they're eligible by excluding these contraindications, liver disease, alcohol abuse, hypersensitivity to isoniazid. If they're pregnant and they have high CD4 counts, they do not qualify for isoniazid TB preventative therapy. If they do not have any of these contraindications, they can then be started on isoniazid prophylaxis therapy or even other TB preventative prophylaxis therapies as needed. In terms of dosages, the adult dose is 5 milligrams per kg per day to a maximum of 300 milligrams per day. We give it to a maximum of 12 months. And then children where there is a close contact are also eligible for 10 milligrams of INH per kg per day for a maximum of 6 months. Ensure that patients taking isoniazid also are given pyridoxine, 25 milligrams per day to prevent peripheral neuropathy. Ensure that adherence and counseling is given. We monitor side effects, and there's regular TB symptom screening, and ensure that those who are symptomatic are investigated and those who are asymptomatic can then continue to take their prophylaxis. Again, thank you very much. I hope you have managed to learn something about isoniazid prophylaxis therapy. In the next session, we would look into the new changes, specifically focusing on the shorter regimens for preventing TB. Thank you very much.